According to the International Diabetes Federation Atlas 2021 report, that approximately 537 million adults aged between 20 to 79 years are living with diabetes, and 10.5% of the adults population has diabetes, with almost half unaware that they are living with the condition. The total number of people living with diabetes is projected to rise to 643 million by 2030 and 783 million by 2045. 3 in 4 adults with diabetes live in low and middle income countries. Diabetes is a major health issue that has reached alarming levels. Today, more than 500 million people are living with diabetes worldwide. According to World Health Organization, 1.5 million people in the world dies due to diabetes every year. But many don't fully understand what it is or how it affects the body. According to the IDF Atlas 10th edition report, top 10 countries for number of adults age 20 to 79 years with diabetes in 2021 and 2045.
Diabetes mellitus is a chronic clinical syndrome characterized by hyperglycemia due to the lack of insulin. The symptoms are polyhydra, unusual thirst, polyuria, frequent urination, and unusual weight.
Diabetes is a growing epidemic.
500 million people around the world suffer from type 2 diabetes.
Today we will talk about diabetes causes and some preventive tips. So let's start. Diabetes is a condition where your blood sugar or glucose gets too high. Glucose is the body's main source of energy, which comes from the food you eat. To help manage blood sugar levels, the pancreas produces a hormone called insulin. Insulin plays a crucial role in moving glucose from the bloodstream into your cells, where it can be used for energy. However, in diabetes, if the body does not produce enough insulin or can't use it effectively, causes sugar or glucose to stay in your blood, which leads to high blood sugar levels. This can cause of further health problems if not managed properly. There are 4 main types of diabetes: prediabetes, type 1 diabetes, and type 2 diabetes, gestational diabetes. First, prediabetes. Prediabetes is a health condition where blood sugar levels are higher than normal but not high enough to be classified as type 2 diabetes. It serves as a warning sign that you may be at risk for developing diabetes in the future and can be cured if you diagnosed it on time. About this diabetes symptoms and prevention we will discuss in our next video. Let's discuss type 1 diabetes. This is when the body's immune system attacks the insulin producing cells in the pancreas. People with type 1 diabetes need to take insulin every day to survive because their body can't produce it on its own. Type 2 diabetes. This is the most common type of diabetes. In type 2 diabetes, the body does not use insulin well. It often linked to being overweight, not getting enough exercise, or having a family history of diabetes. Some people can manage it with a healthy diet and exercise, while others may need medication to help control their blood sugar levels. Gestational diabetes. This type occurs during pregnancy when the body can't make enough insulin to support both the mother and baby. Gestational diabetes usually goes away after the baby is born, but it increases the risk of developing type 2 diabetes later on in life. Common symptoms of diabetes. How do you know if you might have diabetes? Here are some signs to watch for. Feeling very thirsty all the time.
I'm thirsty.
needing to go to the bathroom often, especially at night, feeling extremely hungry even after eating, losing weight without trying, feeling tired and sluggish all the time. If you notice any of these signs, it's good idea to talk to a doctor. Is it important to manage diabetes? If diabetes is not managed properly, it can lead to serious health complications, including heart diseases. High blood sugar can damage your heart and blood vessels. Nerve damage. This can cause pain, tingling, or numbness in your hands and feet. Kidney damage. Diabetes can harm the kidney and lead to kidney failure. Vision problems. High blood sugar can damage the blood vessels in your eyes, leading to vision loss. Foot problems. Poor blood flow can cause cuts or sores on your feet that heal slowly or become infected. Keeping blood sugar levels under control is key to preventing these complications. How is diabetes diagnosed? Doctors use several tests to check for diabetes. A fasting blood test to measure your blood sugar levels after not eating for a period of time. An oral glucose tolerance test, where you drink a sugary drink and your blood sugar levels are measured over a few hours. An A1C test, which shows your average blood sugar levels over the past few months. How to manage diabetes? Now, let's look at some simple tips on how to manage diabetes effectively. First, healthy eating. Eat balanced meal that includes fruits, vegetables, whole grain, and lean protein. Avoid too much sugar, processed foods, and unhealthy fats. Second, exercise regularly. Staying active helps control blood sugar. Aim for at least 150 minutes of moderate exercise each week. Simple activities like walking, biking, or swimming can make a big difference. Third, stay educated. Learn more about diabetes is one of the best ways to take care of yourself. Understand what causes your blood sugar to rise or fall, and how to handle those changes. Fourth, check blood sugar regularly. People with diabetes should regularly check their blood sugar levels. This helps to know whether you are managing your diabetes well or if any adjustments are needed in your treatment plan. Fifth, emotional well-being. Living with diabetes can be challenging, not just physically but also emotionally. Stress and worry are common. Remember, it's okay to ask for help. Talk to your friends, family, or a counselor if you need support. You don't have to manage it alone. In summary, diabetes is a serious condition, but with proper care, you can live a healthy and active life. Follow your doctor's advices, make healthy lifestyle choices, and stay positive. I hope you understand diabetes. I wish you a happy and healthy life. Please like, share, and subscribe to my channel and share this video to others.